The cause of this crisis is no secret. NHS dental services, as is the case for our public health service at large, is chronically underfunded by the government. No doubt the minister today will reel off a big long list of figures about how much they're spending on dentistry. But the reality speaks for itself. According to the British Dental Association, NHS general dental practice is already the only part of NHS England operating on a lower budget in cash terms than it received in 2010. That means in real terms, net government spending on general dental practice in England has been cut by more than a third in the last decade. And these problems are only set to get worse. According to the British Dental Association, around a quarter of dentists plan to stop providing NHS services and move to fully private provision. Over a third plan a career change or early retirement in the next 12 months. I'll finish by stating the obvious. Dental care is healthcare. If people in my constituency cannot access the healthcare they need when they need it, then I'm afraid to say that we have a national health service in name only.
Underfunding is the basis of so many long-term problems. I must say that the data on number of practices providing NHS dentistry makes a depressing reading. The British Dental Association has reported that the number of practices providing NHS dentistry fell by more than 1,200 in the past 5 years. Adding the pandemic to this equation means that the nation is facing an exodus of dentists from the NHS. As I said, the upcoming reforms must be meaningful. They must expand access to NHS dentists across the country.
Dental practices are facing issues clearly before COVID. The challenge is in part a workforce one. So the British Dental Association found that 75% of dental practices are struggling to fill vacancies. Over half of newly qualified NHS dentists under 35 are thinking of leaving the NHS in the next 5 years, with many going into private practice.
The way the dental contract is structured with the ridiculous and counterproductive targets does not make things any easier. Introduced in 2006, it is totally discredited and has always been unfit for purpose. It is totally incompatible with providing safe and sustainable services for patients both during and after pandemic, and it must be reformed.
The tightening of the thumbscrews on dentists through their contracts shows no mercy, despite their call for ventilation equipment funding, high-grade PPE, and understanding that while treatment rooms are having to lay fallow before a deep clean can commence due to the aerosol-generating procedures, this eats into dentists' ability to deliver their contract obligations. These arbitrary, unevidenced targets require dentists to work round the clock, cancel, leave and often their whole life, and necessitate dentists to focus on high volume, low risk work like checkups, whereas those requiring treatment, not least complex treatment, are made to wait. It's unethical and it's wrong.
I welcome the government's renewed commitment to dental contract reform. It's essential. The new contract must break with units of dental activity, prioritise prevention, and ensure that NHS dentistry is available to all those who need it. After a decade spent developing new systems, it's crucial that the government delivers on their commitment to roll out new contractual arrangements by April 2022. It's also important to make clear that the roots of the crisis we are facing go back well before the pandemic. It's not just about COVID prevention measures. It's been a long time coming, and the pandemic has only lit the touch paper. We are sleepwalking into the biggest oral health crisis since the creation of the NHS. It's time the government took responsibility and rescues UK dentistry before it's too late. Thank you.
Today's analysis by the British Dental Association warns that the extreme pressures of trying to hit unrealistic activity targets and working long hours in heavy-duty PPE have led to an unprecedented crisis in morale amongst the dental workforce, with almost half of NHS dentists saying that it's likely they will reduce their NHS commitment or leave the profession altogether in the next 12 months. So unless we urgently act to avoid that looming exodus of dentists from the NHS, the consequences for patients will be dire.
The time has come for a roadmap to release dentists from PPE and all of the restrictions. We need a return to the pre-COVID treatment of patients, and we need SAGE to look at it and get on with it. That will be the biggest single action that will make the dentists be able to get this backlog into line.
It's important about judgments that have been made in the past, but also as we go forwards, because now that target goes from 45% to 60%, which will last us through to September. So I hope the Minister can tell us what extra support her government will be providing to practices to enable them to increase the number of patients they can see to hit their increased target, to do it safely and to do it in a way that doesn't incentivise perverse working practices that we wouldn't want to see. We know from how the profession feel about this, from that same survey from the BDA, nearly 2/3 of NHS dentists don't think they will hit that target. 88% of dentists report a high impact on their morale of the current conditions. So again, we need to hear from the Minister today what extra support they will get, particularly around the operating procedure, or perhaps, as the Honourable Member for Mole Valley says, a roadmap from restrictions or access to technology to allow them to do more. Throughout this debate, there has been far too much stick and never any carrot. I think it's time to recognise the contribution by working with the profession rather than against them. But of course, as the Honourable Member for York Central said, this pandemic has also exposed a service built on sand. NHS. So to conclude, Chair, we entered this crisis having underfunded and under-supported dentistry. We've navigated this crisis by treating the profession as antagonists rather than partners. But if we want to build a new future for oral health and dentistry, we can do it by investing in it and all coming together to do so. And I hope to...
The pandemic has and continues to have a substantial impact on dentistry. And as I say, I'm grateful to dentists and all their teams for their continued resilience and dedication in providing the best care for their patients under what are extremely challenging circumstances. They have had to adjust working differently, responding to new challenges, especially around infection and control measures, which I know they are finding restrictive. The question of ventilation, which also was brought up by several people, there are significant and practical financial and timing challenges in assessing and putting it in. Not every dentist owns their own premises, not every dentist acts only in their own premises, but I have asked once again NHS England to come back to me on what we can do in this area, what is practical and what can be achieved working with the profession. On to contract reform, the pandemic continues to highlight that transformation in dentistry is essential. If we are to address inequalities, particularly around children's oral health that continue to exist, I want to see the way we approach dental services and oral health change. We've much to build on, but it's time to move from research to action. We're grateful for the prototypes whose commitment to the reform programme has been invaluable over the years, and their ongoing participation has enabled us to gather vital data which will inform the next stage of the reform process. No country has a perfect system. Dentistry offers an incredible challenge. We have a mix of private, mixed and NHS, and I would like to maintain that environment. We need to develop a sustainable long-term approach to dentistry that's responsive to the population, providing high-quality urgent treatment and restorative dentistry.